Hi, I'm Jamie, and I'm excited to be pregnant and moving with you. So just a few tips and things you need to know about any sort of prenatal exercise. First and foremost, common sense, but do check with your doctor and make sure that you're cleared for exercise. If you have kind of a high-risk pregnancy, you really want to check in and make sure you're not doing anything that's going to, cause you issues. But on the other side, if you're healthy and you have a strong pregnancy, you really don't need to be afraid of the pregnant body. You really just need to tune in and trust it. The only things you really need to know about avoiding are lying on your stomach. It seems pretty straightforward. But also lying flat on your back, especially after the first trimester. You don't want to compress the vena cava nerve, which is located on the right side of the body. The vena cava vein, which is located on the right side of the body. So when you do shavasana or anything that would normally you'd lay on your back, we're going to take it on your sides. And in shavasana, it's best to lay on your left side since it's located on the right side of the body. You don't want to put too much pressure on the heart. You also don't want to contract the abs. So no crunches. We're going to do planks and we're going to maintain and pull in the core, but we're not going to contract and crunch in. And then twisting, no deep, deep twists. So you don't want to bring knees all the way into chest and twist with the lower part of the body. You can always twist with the upper part of the body or keep hips stabilized to one side and kind of open up through the top of the back, the shoulders. In fact, it feels really good. So you don't need to be afraid of twists. You're just not going to take the real deep ones. Things to know and to do is that prenatal exercise, you really want to focus on opening up the hips and lengthening and strengthening the side and back body. So as baby starts to take up space in the body, all the organs compress a little bit. We really want to remember to breathe and kind of send the breath through the side body, which we forget about a lot. It's also really good to know that breathing is great for your baby. So their raw nervous system is developing. The long, slow, deep diaphragmatic breathing you do really soothes them and is great for them and helps you connect also. Pelvic tilts are great. Any sort of hip tilting and kind of up and down cat-cow movement is wonderful for the body, especially as you prepare for labor. And then just generally make room for baby. So if something used to feel good and now feels a little compressed or tight, spread the legs a little wider. Give yourself a little wider of a base. Maybe move the arms out a little bit. Common sense, trust your body. These are the things you need to know. And I hope you have fun moving with me.